Hey guys, so we're going to try to do a recorded version of the review for your pharmacology test. I'm going to go over it with you guys. If you have questions, email me those questions directly. I will answer those questions or give me a text. You guys all have my phone number to ask me those questions. Question 1, a milligram is a measurement of, it's a weight, guys. So a milligram is a measurement of weight. It's nothing else. It's not volume, temperature, or length. A milligram is a measurement of weight. 1 gram equals, it's 1,000 milligrams. If I were you guys, I would put that in my mind and remember that, because that can really help you with your conversions on the math portion of the test. Question 3, how many milliliters are in 1 ounce? When you guys think about a 30 milliliter syringe, that is 1 ounce. So the 30 ml syringes that you guys have, that we had in lab and that we have in the hospitals, that is 1 ounce syringe. If you keep that in mind, that's also another conversion that can help you remember things for the math portion of the test. Question 4 has to do with pharmacology itself. A drug that is used to increase blood pressure. We know it's not Avitine. Avitine is a hemostatic agent that stops bleeding. It's epinephrine. Mannitol is for increasing intracranial brain pressure. Heparin is an anticoagulant. So epinephrine is the correct answer. It's going to help increase blood pressure. The action of an anticholinergic drug is to reduce anticholinergic drugs are for reducing secretions. Question 6, same thing. It's just a reverse question to help you guys get in the mindset of seeing the question in a different form, because that's what's going to happen on the CST exam. The questions, you may know things, but it may be in a different form or flipped. For example, this one is the total volume in a 30 cc syringe is 1 ounce. So the question before was how many milliliters are in 1 ounce? It was 30. So now they're asking you how many ounces are in a 30 ml syringe. Question 7, the patient is receiving 1 liter of 5% dextrose as an IV fluid during her 1-hour surgery. The number of grams of dextrose the patient has received during this infusion it's 50 milligrams, guys. So when you think about dextrose, 5% means they're using 5 grams of dextrose in 100 milliliter of fluid. So in order to get that number to 50, you're going to take a 1 liter bag is 1,000 milliliters, right? So and it takes 10 100 milliliter bags, right? This is the way I work it out. It takes 10 100 milliliter bags to equal a 1,000 milliliter bag, right? So if each 100 milliliter bag has 5 milligrams in it and you have 10 times 5 is 50. If you guys have questions on that, shoot me an email. Question 9, the vial the circulating nurse is holding is labeled as 75 milligrams per 1 cc. The surgeon wants 150 milligrams of medication. You will draw up. This one's easy. You're just going to double the amount that they want, because 150 is 75 times 2, right? So 1 times 2 is 2. You need 2 cc's of medication drawn up for the surgeon. Question 10 is, what is used for augmentation of labor? Oxytocin is the correct thing used for augmentation of labor. Question 11, blank stimulate the production of urine by the kidneys. And that's what a diuretic does. Diuretic is going to help the kidneys to produce urine. It's going to help you, it's going to basically flush everything out of your body, get your system working properly again. Question 12. Colored dyes are usually dispensed by the sterile field in glass vials. The most common types of gelatin violet, methylene blue, and indigo carmine are the most common colored dyes. These are things that they use to stain structures within the body. They can also inject these, anesthesia can give these, and they can help when they're doing cystos, so they can see the ureters in the bladder. You'll see sometimes the dye will come out, and they'll be able to see that dye flow, so they know that the ureters are working properly. Question 13. A blank is a drug that inhibits blood clot formation but does not dissolve clots. An anticoagulant. So an anticoagulant does not, it makes the blood, it keeps the blood from coagulating, right? Anti mean not, coagulate. So use your medical terminology on these questions and they'll really help you break them down a little bit. Question 14. Knowledge of a nerve transmission is basic to an understanding of how anesthetics and other CNS drugs work. Central nervous system, guys, that's CNS is what that is, a central nervous system. This question was pretty easy. The other options were CNN, CBS, ABC, and those obviously are all television networks. Question 15. Only intravenous solutions are used to irrigate blood vessels or near open blood vessels. You don't want to, you're not producing blood vessels. You're not going to put contrast into those blood vessels, and you're not going to direct blood vessels. You're irrigating those blood vessels. Question 16. A buccal tablet is placed between the gum and mucous membrane of the cheek. So that is a tablet that they put inside the gum and the cheek. That's part of pharmacology. Let's see, I'll give you guys a better idea of what a buccal tablet is. So they come in forms, they can come in tablets, films, or sprays as well. And basically once it dissolves, it allows it to go directly into the bloodstream for the patient. Exogenous insulin for injection is available in different strengths and differing duration of action. So the only option in this category that really fits is insulin. Catheter tip, no. Lurelock, no. Lurelock is a syringe, right? So that's really the only option for that. Exogenous means outside of the genus. Endogenous would mean within inside the patient. This is based on outside of the patient. The movement of a drug through the tissues and cells of the body, including the processes of absorption, distribution, and localization in tissues, biotransformation, and excretion by mechanical and chemical means, is called pharmacokinetics. So if you really use that medical terminology and break down that word, kinetics is movement, right? So you're talking about things going through the body, moving through the body. Pharmaco means pharmacology. So you're talking about the drug itself moving through the body. So it would be pharmacokinetics. Drug delivery devices such as syringes are calibrated in small increments to provide high level of accuracy. So when you look at your syringes, they have the numbers on them. They broke down by milliliters. That way they're more accurate when we deliver those drugs to the patient. Question 20. To reduce drug error when drugs are being used in the sterile field, each and every drug container and its delivery device must be, you have to label those drugs. You want to label those drugs right when you get them, not before, not a long time after, but as you get them. The right drug is the one that has been ordered by the surgeon or other healthcare provider. So the question was, the blank is the one that the has been ordered by the surgeon or other healthcare provider. So it's the right drug. It has to be the right drug, the right patient. You know, the 6 patient rights that I gave you guys the discussion this week, last week. If you guys, like I said, if you have any questions over the 6 rights of medication, there were several answers in there that you guys can take a look at once you answer. The blank identifies a drug by its molecular structure, and that's the chemical name. The chemical name is actually what tells us what the drug's molecular structure is. You have generic names, and then you have brand names as well. But and then you have the chemical name, which, like I said, tells us what the drug is made of. Question 23. After a blank of a drug, the patient is assessed for physiological changes, including adverse reactions. So after the drug is administered, the patient is monitored for physiological changes, including adverse reactions. When you guys go to the doctor, they give you shots, they give you a special medication at the doctor. They normally hold you there for, 15, 20 minutes to make sure you don't have any adverse reactions to the drugs. Changes both intended and unattended in the body as a result of a drug are called pharmacodynamics. So it's basically the dynamics of how that's working on your body, and it has to deal with how the drug works on your body. So you have the pharmaco, which is pharmacology, right? So referring to the drug itself, and the dynamics is what is happening to the body, what it's doing to you. Same question we've had before. Blank is the study of movement of drugs through the body, what the body does to the drug. And so just keep in mind, when you see this question, when you see movement, it's referring to kinetics. So it's pharmacokinetics. That will help you guys really break down that word. Drugs are eliminated or cleared from the body mainly through blank. Well, everything is pretty much eliminated through the kidneys, guys. The kidneys go down to the ureters, to the bladder, to the urethra, out the body. That's getting rid of the waste. Anything else that's in the body that's not supposed to be there is excreted through the bladder, right? (27) The blank is clear injectable liquid that is radiopaque, opaque on radiographs, and that's iodinated contrast medium. It's a clear liquid. Basically, sometimes looks, when you have it in your specimen cups on the back table, it looks like it's kind of got some little cloudiness to it, but it's a very clear. It's just got some interesting movement to it. That is a iodinated contrast medium, ICM. Question 28. A blank is used as a diagnostics tool to differentiate normal cells from abnormal cells. And that's when they do the stains. That's when they have the pink and the blue, and they actually stain the cells so they can see the difference between the abnormal and the normal cells. Irrigation solutions are maintained at body temperature to prevent. You want to keep the solutions at body temperature because you don't want the patient getting too cold, so you don't want them to become hypothermic, right? So it's done to prevent hypothermia. That's why we keep everything in warmers at the hospitals, so nothing that's too cold goes into the patient, causing them to lose their body temperature. Question 30. The most extreme form of blank is anaphylactic shock, which can lead to death. It's the most extreme form of sensitivity. So the most extreme form of being sensitive to a drug would be anaphylactic shock, which can cause, obviously, that can lead to death. 31. The blank has developed a list of abbreviations that can lead to drug errors. So that's the Joint Commission. They have a list that they give providers, and you may see these listed on the anesthesia card or even up at the charge nurse station. It's a list of abbreviations that can lead to drug errors. That being said, they'll have a list of things that say, this drug sounds like this drug. Make sure, and that's why it's very important that when we're using these abbreviations and we're using these drug names, we are labeling them accurately, and we're actually reading the label off of the drug when the nurse gives it to you and verifying that's actually what they're giving to you. Because some of the labels look similar to other things. It's just very important that we look at those things and verify to make sure the patient gets the right medication. The patient may be started on blank antibiotics for a few hours before surgery to prevent postoperative infection. And so it's intravenous IV antibiotics prior to surgery. And that's pretty common. You'll hear them ask anesthesia, did the patient receive antibiotics? And that's when they always say, yeah, the patient received antibiotics at 0800 or whatever time the patient actually received those antibiotics. Penicillin was developed during the early 1940s. That's when they first came up with the antibiotic penicillin. 34. Macrolides are blank at low levels and bactericidal in high doses. So macrolides are bacteriostatic at low levels. Just remember that. Keep that in mind. If they're in high doses, they are bactericidal. Blank is effective against gram-negative bacteria in which they inhibit protein synthesis. Aminoglycides are effective against gram-negative bacteria in which they inhibit protein synthesis. So the answer is aminoglycides. 36. Whole blood contains serum, blood cells, plus anticoagulant and preservative. Obviously, there's no bone wax, there's no gel foam, no thrombin. Those are all things that are used as hemostatic agents in a patient. So those are exogenous things. We're talking about something that's endogenous within inside the human body. One method of blocking is blank is to administer a competitive antagonist drug that has an affinity for the postsynaptic receptor. One method of blocking neurotransmission is to administer a competitive antagonist drug that has an affinity for the postsynaptic receptor. So you really have to break that question down when they're talking about postsynaptic. They're talking about transmission from nerves, right? Obviously, you're not going to block absorption. It's not going to distribute anything, and it has nothing to do with metabolism. It has to do with the neurotransmission, the nerve transmission. (38) True allergy to a drug is mediated by. So a true allergy to drug is mediated by your immune system. That's what a true drug allergy is caused by your immune system. If you're not immune to it, or if you are allergic to that drug, your immune system comes into play. Antifungal drugs are used for blank and systemic fungal disease. So they're used for superficial and systemic fungal disease. So they can be either or for use of antifungal drugs. Antacids reduce gastric fluid, blank, and volume. So antacids reduce gastric fluid acidity and volume. So they're really bringing down the acidity of the gastric fluid and the volume in your stomach to prevent gastric reflux and things of that nature. A specific protocol method is used to receive and deliver drugs to the blank field. So that protocol method is used to receive drugs to the sterile field. One of the most common drug sources of drug error is failure to properly label syringes and other delivery devices. So you have to label the syringes. If it's being used in an asepto bulb, you need to label that asepto bulb. If there's some type of special solution in there, anything that is delivering those fluids, make sure that it's labeled. If it's just saline, I also label my bulbs for those, just so I have all my bases covered. We're on question 43 now. Blank measures the electrical activity of the heart, which is projected into a waveform. And that's an ECG, is what's measuring the electrical activity of the heart. Question 44. Blank is a digital sensor that detects oxygen saturation in hemoglobin by spectrometry. That's a pulse oximeter. You see them put that on in surgery. They can put them on the ears. They can put them on the fingers. That's letting them know how much oxygen, what the patient's oxygen levels are at. Question 45. Administering blank requires that the anesthesia provider administer a sedative and anti-anxiety drugs as needed and manage any anesthetic and physiological emergencies. Administering MAC anesthesia, which is monitored anesthesia care, requires that the anesthesia provider administer a sedative and anti-anxiety drugs as needed and manage anesthetic and physiological emergencies as well. 46. Blank anesthesia is the injection of anesthetic into superficial tissues to produce a small area of anesthesia. So when they're talking about a small area of anesthesia, they're talking about local infiltration, a local anesthetic. So the answer to that question is local infiltration. Question 47. Spasm of the larynx usually is associated with the airway secretions or stimulation of the laryngeal nerve during intubation or extubation. So a spasm of the larynx can occur at intubation or extubation, either one. 48. Adequate blank is necessary during general anesthesia to manipulate the body wall and other tissues within the operative site. Adequate muscle relaxation is required during general anesthesia to manipulate the body wall and with other tissues within the operative site. So the doctor may tell the anesthesia the patient's abdomen is too tight. They need to give them some muscle relaxant in order to loosen up so the doctor can really work. There are other parts of the body also that are effective. Muscles of any kind need to be relaxed in order to properly be able to retract those muscles and actually get in there and complete the surgery. Termination of anesthesia and the process of regaining consciousness are called emergence. So when the patient is waking up from anesthesia, it's called emerging from anesthesia. Emergence would be the correct answer for question 49. Question 50. A blank is a type of anesthesia in a specific area of the body by injection of anesthetic around the major nerve or group of nerves. So when this is common when they come in and they'll do a regional block of a specific part of the body, and they do that by injecting medication, anesthesia into and around that nerve that affects that part of the body. 51. Blank is a state in which the patient can respond to verbal commands. Minimal sedation. Minimal sedation is done in small cases. They may do them in hand cases, carpal tunnels, things like that, where they're going to have to ask the patient, can you move your fingers? They will do them also when they put the spine stimulators in. When they put those spine stimulators in a patient's back, they ask the patient, when they activate the stimulator, where do you feel do you feel anything? Where do you feel it at? That way they can actually respond. So they just give them a minimal sedation. Blank sedation is used for short diagnostic and minor surgical procedures that do not require deep anesthesia, and that's conscious sedation that should use for a short diagnostic or minor surgical procedure. 53. Blank is treated with mechanical ventilation or, in severe cases, administration of succinylcholine to paralyze the muscle, and that's a laryngeal spasm. That'll be treated. When the patient has a laryngeal spasm, they can ventilate the patient mechanically, or if it's a severe case, then they would actually have to administer succinylcholine. Question 54. Preoperative blank is required to minimize aspiration, inhalation of gastric contents during anesthesia. Preoperative fasting, that's why they tell you don't eat after midnight. You'll see NPO, nothing by mouth is what NPO means. You may see that on the test as well, so keep that in mind. But preoperative fasting, and the reason for that is if you eat and when they go to intubate you or do anything, you could reflux things into your lung, aspirate them into your lung, which can cause aspiration pneumonia in the lungs, and that can cause other complications of surgery. So we're not supposed to eat before we have surgery the day before, or you can eat up until midnight the day before you have surgery. And that's why they always ask them when they first get there, have you eaten today? Have you had anything to drink? That way they know if there's going to be any complications when they intubate the patient. Question 55. In a state of well-being, the body responds readily to blank to maintain life. So the body responds readily to stimulation to maintain life. 56. In anesthesia, blank is the patient's inability to recall events that occur after the administration of specific drugs. In anesthesia, antegrade amnesia is the patient's inability to recall events that occur after the administration of specific drugs. When you have surgery, they've given you the anesthetic. You may not even remember being wheeled into surgery, or you may not remember all the questions or anything they asked you after those drugs were given to you. And that's also a reason we can't have them sign consent forms when they've had those drugs on board, because the patient is not going to recall signing those. The patient needs to be able to recall signing the consent forms for the procedures. Patients undergoing conscious sedation are monitored continuously throughout the whole process. So the question was, what are the patients monitored for during when they're under conscious sedation? And so they're monitored continuously throughout the whole procedure. That way they're looking at their heart rates, they're looking at their respirations, they're looking at oxygen levels, making sure the body's working the way it's supposed to work. Blank is a rare physiological response to all volatile anesthetic agents and succinylcholine, and that's malignant hypothermia, MH. You'll notice they have MH carts at the hospital in case a patient has, if the patient has a reaction, they'll wheel that into the room immediately. If the patient has a history of MH in their family, they will also have that outside the room closely available, because it can be an issue if it runs in their family. 59. The capture and safe removal of anesthetic gas that escapes from anesthesia machine is accomplished with a gas scavenging system. So the gas scavenging system captures and safely removes the anesthetic gas that escapes from the anesthesia machine, so it's not going into the air and causing us any issues as the staff in the room. Circulation of blood to specific tissue, organ system, or whole body is called perfusion. There is a job called a perfusionist where they actually put the blood, the blood will come out. It's done in heart procedures. You guys, if you get a chance to do it in the heart room, it's really a pretty cool thing to see. So it circulates the blood out of the body and then back into the body when they do those heart cases. But circulation itself of blood to specific tissue, organ, or system or the whole body is called perfusion. Topical anesthesia is used on mucous membranes and on superficial eye tissues during ophthalmic surgery. So obviously, if it's topical, it means on top of, right? We're breaking down those words again with that medical terminology. So it wouldn't be, you're not going to put it on nerves because it's topical. Subcutaneous tissue layer, that's below. And then obviously you can't put it on red blood cells either. A blank nerve block provides anesthesia to a specific area of the body supplied by a major nerve or nerve plexus. Plexus is also known as a nerve group. A peripheral nerve block provides anesthesia to that specific area of the body supplied by a major nerve or nerve plexus. Blank is the immediate harvesting of blood on surgical field and reinfusion to the patient. And that's intraoperative cell salvage. Blank is a state of balance in physiological functions, and that's homeostasis. We're trying to keep the body in a homeostatic condition at all times. A pulse blank is a monitoring device that measures the patient's hemoglobin oxygen saturation by means of spectrometry. We've already had this. It's the pulse oximeter. Like I said, that's the one that goes on the finger, or they can put it on the ear. But that's why they also ask the patients not to have any fingernail polish or anything, because sometimes those don't get a good reading if they have fingernail polish on there. Deep unconsciousness, such as that achieved during general anesthesia, results in the absence of protective mechanisms such as swallowing, coughing, blinking, and blank. So deep unconsciousness, you also don't want them shivering. So there's no coughing, there's no swallowing, there's no blinking, and there's no shivering. The central nervous system depression refers to blank mental, sensory, and physical capacity. So central nervous depression means they're diminished. Those things aren't working the way they normally would. So it's a mental, sensory, and physical capacity. It depressed those functions. 68. The blank assistant assists anesthesia care provider in tasks that are delegated according to the AA's practice skills and knowledge. It's the Certified Anesthesia Assistant, CAA. You guys will call them their anesthesia techs. Some of them are certified. Some of them just learn on the job. It just varies, but there is a certification called the CAA for those anesthesia assistants. Hospitals have individual blank protocols. However, specific details are always verified. They have individual check-in protocols for checking each patient in, on how they check them in, what questions need to be asked, what forms need to be signed, who needs to have those forms signed. There's procedures for every hospital that are outlined by governing agencies. Diagnostic testing to determine the patient's blank level has been routine for many decades. Diagnostic testing to determine the patient's risk level has been routine for many decades. So they do diagnostic tests. They do blood draws. They look at all these different levels of things to see if there's anything that they can identify that's going to cause any complications during the patient's surgery or during any type of small procedure, or even sometimes for administering drugs. They'll look at these patients' risk level. Pre-operative medications are documented in the patient's medical and blank records. So it's in the medical and preoperative record, which are all part of the patient's total medical file. The hospital will keep those. Any medication ordered but not yet given may be administered in the holding area as directed by the surgeon or ACP, anesthesia care provider. Normal body temperature for a human is 97 to 99.5 degrees. That question may pop up on your exam, so kind of keep that in mind. Toxic reactions to local anesthetics arise most often during blank, block, and epidural anesthesia. So toxic reactions normally to local anesthetics arise most often during regional blocks and epidural anesthesia. Final question. A coma is a state of deep blank in which most brain activity ceases. A coma is a deep state of unconsciousness. So when people are in a coma, they're unconscious, right? And most of their brain activity is no longer working at that time. Okay, guys, well, that completes our review for pharmacology. What I want from you guys is to listen to the review, tell me what you think, ask me specific questions via email, gtrout@southerntech.edu. We're going to move forward next week and do some more reviewing. I've kind of sent out a discussion question for you guys to give me some thought on what's going to help you guys to really absorb some of this material, and so we keep moving in a positive manner to keep you guys learning and to keep this knowledge fresh while we're off campus. Like I said, if you have any questions, guys, just get back to me, okay? Have a great day.